Contrary to what you might have heard, the American healthcare system is functioning perfectly. Patients dread using it, doctors are frustrated and demoralized by it, and the nurses are quitting in huge numbers. The reason I said that the system is working perfectly is because it is doing exactly what it has been designed and finally calibrated to do to generate huge profits for the multi billion-dollar corporations that control it. The fact is that the American healthcare system has sadly become almost fully corporatized. It has become big business like a Fortune 500 corporation. It has been taken over by billion-dollar corporations who own not just one or two hospitals in a city, but entire hospital systems across multiple states. They have enormous financial power and political clout. As a result, every doctor, nurse, healthcare worker is simply an entry in a billion-dollar Excel spreadsheet. We, as doctors, nurses, and patients, we exist to generate immense profits for this enterprise. When I graduated from medical school in 2001, I had no idea that it would turn out this way. I absolutely love what I do as a surgeon, and I'm very fortunate to be able to do what I do. Having said that, it is true in some ways that this has been a journey of disillusionment. The funny thing is that more than 90% of the doctors who'll watch this video will agree with what I just said, but they will never say this out in public because they are afraid. You might ask why they're afraid of speaking up about corporatized healthcare. Let me show you why. Look at this graph. You can see that the number of physicians who are now employees of these corporations has been rising rapidly for the past decade. As of 2024, more than 77% of all the physicians in the US are now employees of these corporations. Let's stop and think about this for a second. Fewer than 25% of physicians in the US are now independent in private practice like I am. But this is becoming more and more difficult as time passes. Private practices are being squeezed like never before by the healthcare systems, the insurance companies, increasing business overhead, and increasing and more onerous government regulations. Today, I want to show you how corporatized healthcare harms three groups: patients, physicians, nurses, healthcare workers, and most importantly, society as a whole. It's not a pretty picture, and unfortunately, I'm not optimistic about how things are going to go in the future. So let's talk about how corporatized healthcare affects patient care and what the patient experience is. I can't tell you how many times I've been told by patients that when they called hospital system X, they had to wait 2, 3, 4, 5 weeks to get an appointment. And this is really not the fault of the doctors at those hospitals. The doctors have really no control over their schedule. Each doctor at a corporatized healthcare system is told how many hours they have to work a day and how many patients they have to see an hour. And when you finally do end up seeing the doctor, unfortunately, a lot of times you spend very little time with the doctor because the doctor is obligated to see two, three, four, even five patients an hour, depending on their specialty. So a lot of patients, they spend very minimal time with the doctor. And this, again, is not a fault of the doctor at those hospital systems. They have no control over their schedule day to day, week to week, or month to month. What ends up happening is that a lot of the pressure is alleviated by using mid-level providers like physician's assistants and nurse practitioners who, again, are doing their very best to give the patient the attention that they need. But again, that is not a substitute for seeing a doctor. Also, a lot of times, the corporate healthcare systems, they will treat every problem by an algorithm. For example, if you call in to a hospital system and say you have sciatica, they will have you see practitioner A. And if that treatment does not work, they'll push you over to B. And then if that doesn't work, they'll push you up the escalation ladder. And finally, you may end up meeting the surgeon. Well, all patients are not the same. Patients have to be listened to individually, and every patient with sciatica is not the same. Some people have horrible, severe sciatica that needs to be seen within 24 hours. Other patients can perhaps wait a little bit longer. So, the whole experience of a patient when they go through the systems is really a very impersonal or sort of a cookie cutter type of an experience, which they really do not enjoy. One of the biggest pet peeves that patients have when interacting with their doctor's office is that, for example, when they call the doctor with a question, they relay the message, and the message is relayed either to the secretary or the nurse. The nurse then confers with the doctor, and then they give the answer back to the patient via the nurse. What the patient really wants to do is to talk to doctor themselves. Again, this is not a fault of the doctor at these big hospital systems because they're absolutely overwhelmed. But the patients at the same time are really not very happy when they're not called back by the doctor, but instead they're being called by the nurse. In my practice, I call every patient back myself when they call me with any question or any problem. That is the difference. Another irony of interacting with a big healthcare system is that, interestingly, healthcare systems have better contracts with insurance companies that favor the healthcare systems. So, ironically, they get paid more for providing the same service compared to somebody in private practice like myself. This is something which is very frustrating because the patients end up with higher out of pocket expenses, and the total bill at the end of the day for the patient for the treatment that they get at these hospital systems tends to be significantly higher than getting the same treatment with private practice. So, ironically, the patient experience at these big healthcare conglomerates tends to be more expensive and less personal. Patients really don't like that. This brings me to how the corporatized healthcare system affects doctors. Well, one of the biggest problems that doctors have within such healthcare systems is they have really no autonomy. They really can't control their schedule. They're obligated to see a certain number of patients a day, and they can't really make significant changes in the structure of that arrangement. They're also kind of forced by productivity quotas to do a certain number of surgeries, to see a certain number of patients. Otherwise, they will not make their bonuses. And they have to hit a lot of what the MBAs call metrics, which basically means that they have to hit certain benchmarks. And those could be a whole bunch of benchmarks. But if they don't meet those quotas, they may not get their contract renewed. They may not get their bonus for the year, even though they may have worked very, very hard. Because of this, a lot of doctors in such healthcare situations, they have a lot of burnout, a lot of depression. A lot of doctors in such situations have very low morale. And if they see a problem within the system, they may be very hesitant about reporting that because of a fear of retaliation. And at the end of the day, the doctors in such healthcare systems, a lot of them just quit and they switch jobs. They may even go out of town. But unfortunately, since more than 75% of the physicians in the United States are employed, the second job may also be a corporate job where they're working for a big healthcare system, and they may not be any happier over there. This is why so many doctors are retiring early and they're just quitting the field of medicine. Now, the experiences that doctors have within the healthcare system of this kind, you can translate that to how nurses are treated, how physicians' assistants are treated, how nurse practitioners are treated. So there's always a huge turnover within these systems because the healthcare system considers each doctor as sort of like a Lego piece. You know, you just take it out, put another Lego piece in, and voila. But healthcare is not like that. Our interaction with our patients is something which is very personal, and we build relationships with our patients. And that is something which cannot be transferred from doctor one to doctor number two. So at the end of the day, a lot of the doctors within these systems are very, very unhappy. And I can attest to that from personal experience. I know colleagues in healthcare, doctors all over the country, and they say the exact same thing. So the general level of dissatisfaction among doctors, and people might be very surprised to know this, is surprisingly high. Doctors are not happy. So how does corporatized healthcare environment affect society as a whole? The biggest effect that corporatized healthcare has on society, I think, is the fact that it severely limits the choices that are available to patients. Over a period of time, if your city had six or seven hospitals, well, now they're basically consolidated and you have two competing healthcare systems. So you basically have functional monopolies. So there might be a huge healthcare system A and a healthcare system B. But from a practical standpoint, both of these hospital systems are basically about the same. So you have to kind of pick your poison. What do you want? The other effect of rising monopolies is rising of healthcare costs, because paradoxically, these big healthcare systems can negotiate much better contracts when they negotiate with healthcare insurance companies. And because of their bargaining power, they can provide a service at a significantly higher cost than a private practice would be able to. And as a result, the cost of healthcare will rise, and it has risen dramatically in the United States. In fact, healthcare costs are the number one cause of personal bankruptcies in the United States. So, overall, this breeds a level of dissatisfaction among the population, and it leads to a lack of trust in the healthcare system. I think the biggest example of that was what happened in 2020. I'm very curious what my viewers will think about what I just said today. If you have any thoughts, please share in the comments below. Thank you for watching.